Dr. Sammarco from OrthoCincy, and in this video we're going to talk about arthritis of the great toe, or Hallux rigidus. Arthritis of the great toe is incredibly common. It's probably one of the most common things that I see in my office. Most patients who have arthritis of the great toe can be effectively treated without surgery, although some people do get more advanced disease that requires some surgery. When we're looking at arthritis of the great toe, or Hallux rigidus, we usually grade it in 3 stages. Grade 1 is intermittent symptoms. Sometimes there's a spur on the top of the joint, and that is the type of arthritis that usually can do pretty well without surgery. If it does come to surgery with that particular condition, usually the patient will improve significantly if we simply remove the spurs from the joint. Grade 2 Hallux rigidus is a little bit more advanced. Those patients tend to have more pain. When we look at an x-ray, there's not just spurs on the joint, but there also is a narrowing of the joint space. So the cartilage inside of the joint has begun to wear away, and usually the top part of the cartilage wears away first. Those patients will typically do better with some conservative management, and we can treat them with things like medication. We can treat them with an occasional steroid injection. They may do well with an orthotic. If the patient is not improving with those simple things, then a lot of times they will improve with surgery. Surgery for grade 2 would be removing spurs, and sometimes what we'll do is we'll do something called an osteotomy, which will open up the joint space a little bit and give them more motion. Grade 3 arthritis is where the patient really has lost almost all of the joint space. Grade 3 arthritis usually causes more severe symptoms. There's usually very little motion left in the joint, and there are usually large spurs that have surrounded the joint. For most patients that have grade 3 arthritis, we're going to treat that grade of arthritis with what's called a fusion, and that's where we bind the toe together. So in summary, arthritis of the great toe is graded 1 through 3, mild, moderate, and severe. Mild disease typically will respond to conservative management, meaning an orthotic, medication, avoiding activities that aggravate it. And if it does come to surgery, usually it just requires removal of some of the spurs that form around the joint. Grade 2 disease is more advanced. There's some joint space narrowing as the cartilage is worn out of the joint. They usually are larger spurs. Again, conservative management is our first treatment. Surgical treatment is removal of spurs and possibly opening the joint with something called an osteotomy. Grade 3 disease, where there's very little joint surface left and very little joint motion, is usually best treated by fusing the joint. Dr. Sammarco from OrthoCincy, and thanks for listening.